Yes, so good evening. Um, Sir, my name is Colade, and today I'll be conducting your assessment as your therapist, as your social worker. Currently, um, an unlicensed, licensed eligible social worker, um, which means I'm under supervision. So at the end of this meeting, you might see me take the results of this meeting to consult with my supervisor, so we could come up with it. He could oversee my diagnosis, um, and then usually with this assessment, they usually last between 45 minutes to 2 hours, depending on the questions and how much information and detail needs to be shared, and then sometimes people need to take breaks in between. Um, and then I guess with the agenda of the assessment, basically, and the difference between an assessment and then therapy during assessments, we're just kind of going sort of like rapid fire. It's different from therapy where each issue will have to break it down for processing. However, from the assessment, the goal will be to look at the needs, strengths identified, and then kind of help you connect with further services that would help with addressing the problems and enhancing well-being. And then also with I guess with setting the agenda, feel free to let me know if there's any other aspects in the assessment that I haven't touched on. So feel free to come in um, and help. So as far as with the helping process and then with the scope of this agency, so this agency majorly focuses on outpatient services, meaning we're meeting with clients not in a residential or inpatient service. We're just giving them additional services where possibly it could be on Zoom, or maybe they're coming in from their home for in-person meetings, and then we're providing therapy. We also have psych services. If you wanted to switch where you're getting your medications from, you could switch that to our agency. We also have case management services. We have adult case management. We have children's um, case management services. I guess with if you meet the if you meet the criteria for case management services, that's a service that we could provide. And then also we have groups and individual therapy sessions. So depending on which one you prefer, we have groups or individual, and we also have some more groups that are more intensive depending on the level of care after the assessment. We have intensive outpatient groups that last 3 hours, 3 times a week, and that group holds on Monday, Tuesdays, and Thursdays. Um, I guess, and then I guess my role in this assessment is just to be an assessor. Um, Again, not as a therapist today. I'm just taking in questions in a lot of domains that include substance abuse, history, some demographic history, some family history, health history, um, and then your role as a client would be to provide me with each of this information, and then we can put it up on the system. Um, and then next um, is confidentiality. So everything we're going to be talking about in here is confidential, meaning I cannot share that information with anyone outside of this room. Um, However, there are grounds for breaking confidentiality, and these grounds include um, if you give me the permission through signing a release of information to share, for example, could be your medical records, maybe making a referral, and you need me to share medical records for maybe psych services to get medication and stuff. And you sign that release, then I'm able to, you've given me consent to break that confidentiality and then share information. And then, second of all, is if I've been subpoenaed um, by the court to come testify, um, then that would be a ground where I would have to break confidentiality and share information from the sessions. And then lastly, another ground for breaking confidentiality would be if, for example, during this assessment, if you make a threat, um, if there's a threat of harm to yourself or someone else that you disclose during this assessment, that would be a ground for me breaking confidentiality, and I would have to report that to the to an authority, depending on if it's child abuse, probably would be the Department of Children's Services. If it's something, no, maybe if it's pertinent to an adult, it could be Adult Protective Services, or if it's just something violent in general, it could be to the police. And then if it's threat of harm um, to yourself, also um, potentially that could result in like a medical hold, a psych hold. Um, so I guess first of all, I would like you to um, introduce yourself and let and I guess I'd like first of all for you to introduce yourself. First of all, if I could ask for your name and then um, your date of birth, um, and then I guess how many, maybe the last four digits of your social security. So I guess let's just start from your name and then your date of birth.
Well, my name is Jacob Smith, and my birthday is 10/31/57.
It's nice to meet you, Mr. Jacob Smith. Do you go by Jacob, or do you have a preferred name that you go by?
I go by Jacob.
Jacob. All right. Yeah. Um, so I guess briefly, if you could explain what brings you here to out to this outpatient clinic, and how can I help you? How can we help you? Yeah.
Well, my wife, she has always helped me out a lot. And a couple months ago, she had a really bad fall at our house while I was asleep. And she basically tumbled down a flight of stairs into our basement, and she has osteoporosis, and the surgery required her to have extensive reconstruction for her hands, and that put her in the hospital for many weeks. And my kids, they noticed that I've been having some problems with falling because of a drinking problem, and they have encouraged me to come here and get some help.
So, yes, it sounds like you're here to get help for a drinking problem. As I said, I wouldn't break it down and process any of that information, but you would see as we go through some of these domains, particularly there's a domain about substance use history, then we can, I guess, ask and delve a little further into that substance abuse history and then the help that you've possibly gotten before and what is the plan going forward. Um, so I guess first of all, I would ask some of these questions. This one's particularly are not in a domain. I guess you're just basically asking about how you've been feeling lately. Um, so um, I guess they're asking over the last month how you've been feeling lately. So over the last month, um, would you say you have little interest or pleasure in doing things, and then the it ranges not at all, several days, more than half the days, or nearly every day.
Uh, More than half of the days.
Yes. Um, and then would you say, have you been feeling down, depressed, or hopeless in the past few months?
Yes,
So I guess yes, is that on several days? Is that more than half of the days, or is that nearly every day you'd say you've been feeling depressed and or hopeless?
I would say nearly every day.
Oh, um, and then your sleep. Um, would you say over the past month, have you had trouble falling asleep? Have you had trouble staying asleep, or have you had trouble sleeping too much? Have you had problem with any of those three?
I've had problems not being able to stay asleep.
Uh, so you had problem not being able to stay asleep. Would you say that happens on several days, more than half of the days, or nearly every day?
Several days.
Several days. Um, and over the last month, would you say that you've been easily annoyed or irritable or irritated by things, people?
Yes, I have been.
All right. So, would you say that happens several days, on more than half of the days, or nearly every day?
Several days.
Yeah. Well, for um that domain, I guess those are the questions. We're just trying to access, I guess, how your mood has been over the past month. And now we're moving on to another domain called past psychiatric history. Um, have you ever been diagnosed with a mental health condition?
I was diagnosed with depression by my PCP.
Um, So obviously that's yes, and then you've been diagnosed by depression by your PCP. So has there been any other condition that any other mental health condition that you've been diagnosed apart from depression?
Not that I'm aware of.
Um, have you ever been hospitalized for psychiatric reasons?
No.
No. Um, so right now, um, are you currently seeing an individual therapist or attending any group therapy?
No,
Have you ever received psychotherapy or counseling?
no, I have not.
I know you mentioned that you had been diagnosed with depression. Um, have you been prescribed any medication for depression?
I was prescribed Buspar,
Mm,
but I have quit taking it.
you're taking it. So I guess is that something that you're interested in? Um, I guess first of all, do you still have like a current um like prescription? Are you still being written a prescription for it?
I don't.
All right. Mm, yeah, so I guess that's it for the past psychiatric history, and then moving on to family mental history. It's a much quicker domain. Um, so have any of your biological relations had problems with depression, attempted suicide, anxiety, hearing voices, drugs, alcohol, or mental health problems?
Well, my mother, she had major depression,
Mm,
and my father was abusing alcohol.
mm. I guess apart from those two, do you know if your grandparents, siblings, or have any history with depression, attempted suicide, anxiety, hearing voices, drugs, alcohol, or mental health problems?
I think on my mom's side, her her mother also struggled with depression.
But yes, going back, probably should have asked you earlier, but I could ask now. So do you have children?
I do. I have two.
So would you mind telling me their names?
Well, one's name is Jimmy
Mhm.
and one's name is Maria.
So um how old are your children?
Jimmy is 37 and Maria is 34.
Thank you. And now we're moving on to substance use history. I know at the beginning you had mentioned that you were here to get help because of an alcohol issue. And now this domain specifically talks about substance use history. However, it not only focuses on alcohol, it also focuses on other substances. Um, so how many caffeinated beverages do you drink a day? I mean, caffeinated beverages include coffee, sodas, tea, energy drinks, and the likes. How many caffeinated beverages do you drink in a day?
5.
Then moving on to your tobacco use history. Have you ever smoked cigarettes?
Yes.
Do you currently smoke cigarettes?
Yes.
How many packs per day on average do you smoke?
a pack a day.
And for how many years have you smoked?
For the past 40.
Mm, that's fine. Have you, I guess in between that 40, have you ever like quit for a period of time?
I did quit for 2 years after my son Jimmy was born, but then I picked it up again right before my daughter Maria was born.
And do you currently or in the past, do you currently or in the past use pipe, cigars, or chewing tobacco?
I do chew occasionally when my throat gets sore from
Mm.
smoking, but mostly it's just cigarettes.
Would you, is for how many years, I guess, have you also been using the chewing tobacco?
The same amount I was smoking.
So, so I guess alongside tobacco use and the chewing tobacco, is this something you're ready to quit at this time?
I would be open to the idea.
Mm. And now moving on to the alcohol history, which you had referred to earlier on. Um, so how often have you had a drink containing alcohol in the past year? Um, so would you say never? Do you drink like monthly or less than monthly, or do you drink 2 to 4 times a month, or how often would you say?
I would I would say at least 5 times a week.
Mm. And then I guess to be specific, about the alcohol that you drink. So, are you drinking specifically beers or liquor, or what type of alcohol, or wine? What type of alcohol are you drinking?
Mostly beer, but sometimes liquor too.
Mm. And then I know you say you drink at least 5 times, usually 5 times a week. So, usually on a typical day of drinking, in the past year, Um, how how many drinks a day are you having?
Between 8 and 10.
I guess, have you had experienced any of the following because of your drinking? This includes blackouts, legal problems, relationship problems, shakes. So I guess we could start with, have you experienced blackouts, legal problems, or relationship problems because of your drinking in the past?
I I have experienced a few blackouts. Um, Most recently, I blacked out and I fell in our house before my wife, fell and had to have surgery.
Do you also say that you've had relationship problems because of your drinking?
I have had some problems with my wife, but we've kept it from the kids, and I'm kind of isolated from my friends now because I retired from my job and I don't get to see them anymore.
Mm. And then with, I guess this isolation, because it'd be a domain, guess I could just hit that right now. So being isolated from friends, are you isolated all the time, or maybe a few times a week or a few times a month from your friends?
It's mostly all the time. I mean, other than if I run into them in public.
And also, I guess going back to some of the things you've experienced because of drinking, have you had seizures, maybe liver problems, or other um, health problems because of drinking?
Not that I have been diagnosed with.
And has drinking ever led to a job loss, or you not performing on the job or receiving sanctions on the job because of drinking?
No,
So in the past, have you attended any alcohol treatment program?
no.
Mm. And would you be, I guess you'd be, as you said, you'd be interested right now in getting help or getting into an alcohol treatment program?
I would be open to the idea.
And then with other substances, have you ever tried? Let me know if you hear any of these substances that that you might have tried or not. Have you ever tried cocaine, stimulant pills, heroin, LSD or hallucinogens, marijuana, methamphetamines, painkillers not prescribed, methadone, tranquilizers, sleeping pills, ecstasy, IV drugs? Have you ever tried any of those?
I tried marijuana when I was in my 20s, but that's the only one out of all of those.
With marijuana, do you still use marijuana?
No,
And at what was there ever any point um where you were using um marijuana often?
no.
And now we're moving on to another domain called history of homicidal and suicidal um behaviors. Um, have you ever had any thoughts of hurting yourself or someone else?
I have in the past
So was that of hurting yourself or someone else?
uh, hurt myself.
Did you ever like take actions to hurt yourself?
No,
Or did you ever like have a plan in your head without taking action to hurt yourself?
I did have an idea of how I could hurt myself, but I ended up not following through.
Then I guess moving on quickly to physical health. Do you currently receive medical care, I guess, for any ailment apart from the depression?
No.
Do you have any food allergies?
I am allergic to peanuts.
Do you have disordered eating habits, for example, binge eating, self-induced from eating?
No.
And then um, I guess moving on to a domain about your personal history. I guess in general, how would you describe your childhood?
I would I would say that it was mostly good.
So who raised you?
Both my mother and father.
How, yes, how would were you disciplined by your mother and father growing up? In what ways did they discipline you?
Um, they would they would ground me from going out and doing things, and
Mm.
sometimes my father would hit me.
Did you, so did you feel like the way your father hit you was that um I guess was that often, and would you say like you witnessed or experienced physical, emotional, or sexual abuse in your childhood?
Um, well, I don't think that my father done it in an abusive way, but I did have some abuse from my uncle.
Mm. So what type of abuse was that? Was that physical, emotional, or sexual abuse?
Uh, Physical and sexual.
Sexual. Well, lastly, um, for this last domain, quickly, I'd like to ask you, what would you consider to be your personal strength? So I guess everyone does have a strength, something, for example, that you're good at, something that you enjoy doing. So what would you consider to be your personal strength?
I do enjoy being there for my family.
You know, and would you say that you, apart from you being there for your family, would you say that your family is also there for you?
Yes.
So,
Although my kids do live far away, I do talk to them on the phone a lot.
you know, then what would you consider to be personal areas which need improvement?
I would say my drinking problem for sure. Um, and I would also like to feel happy again.
So sounds like the drinking problem, possibly the depression um, problem. So I guess right now haven't done the domains for the assessment. It sounds like there's an alcohol problem, and then the depression problem, which you have been diagnosed with prior to now. and had been taking medication before. So I guess briefly, was that medication, was it helping you?
I didn't think it was.
And did you ever try another medication?
No.
Anyway, I guess before we can prescribe medication here, you have to have been coming to, like, for example, a therapy session. At least you have to have attended 4 sessions before we can now refer you to psychiatry services. So medication is something you can discuss with like a therapist in the future, and then with medication and psych services. So right now, um, I guess having consulted with my supervisor, I guess we have an alcohol use disorder diagnosis, and then we also have a um, a depression. I guess it's based on your previous diagnosis of having a depressive disorder. Um, I guess, and it sounds like it's a major depressive disorder because it's I guess affecting functioning on major parts of your life. So I guess then we can subsequently now schedule a follow-up meeting where you can begin having services with a therapist. So I guess does the 14th of this month at 1 p.m. work for you?
Yes.
All right.